Hi, my name is Dr. Jay Lim, consultant urologist, and welcome to another episode of our Keep It Simple series where we discuss common urological methods in a simple and easy to understand way. Today we'll be talking about microscopic hematuria, or what we call AMH. AMH stands for asymptomatic microscopic hematuria, and it's usually a condition whereby you are told that you have some blood that's detected in your urine sample. The reason as to why a lot of patients come to urologists is because as part of their health screening, they require to give a urine sample and a urine dipstick was performed as part of that workup. What happens is these dipsticks are very sensitive to detect small amounts of red blood cells in the urine, and they are referred to urologists for further workup. Fortunately, the causes of microscopic hematuria are mainly non-cancerous ones. It can be as benign as not having enough fluid, dehydration, or can be due to big prostates in male or menopausal changes in females. At times, you can also have urinary stones that shift a bit and therefore causes a bit of friction and blood comes out in the urine. Although at rare times there can be a small chance that is due to a small lesion that's growing along the urothelium. Now the urothelium is the lining of the urinary tract that starts from the kidney all the way down to the bladder and ends at the urethra. Naturally, if that's being the case, you want to discover this lesion early on so that you can actually intervene and not let it become a bigger problem down the road. Today, we'll be talking about the various investigations that we do for conditions like this and how we can actually follow up thereafter. So without further ado, let's get into the topic for today.
So, hematuria can be divided into two major types, macroscopic or microscopic. Macroscopic or gross hematuria is when you can actually see that your urine colors has actually become red colors or pinkish in color, while microscopic hematuria is when your urine color looks exactly like it is normally and you cannot see the difference with your naked eyes. Many times microscopic hematuria is detected because you had a dipstick done, which otherwise you would not have been aware that you were actually having red blood cells in your urine in the first place. What are some of the causes of hematuria? In many times, we cannot find out the exact true reason as to why you are having red blood cells in the urine. This is what we call idiopathic. For male gentlemen, when your prostate is slightly on the large side, blood vessels can burst, leading to red blood cells flowing into the urine, therefore detecting it on a dipstick examination. A significant cause of blood leaking into the urine is medication, and I will go into that in the next following slides. For the ladies, especially when you go through menopause or you have menopausal changes, sometimes red blood cells can also leak into the urine as well. And in these cases, these are benign causes and nothing to be worried about. Should you have stones in the urinary systems, sometimes friction due to movements of the stones can cause red blood cells to flow into the urine as well. Of course, cancers are one major cause of blood in the urine that we want to know if it exists, and if it does exist, we want to know early as well. Because when they are early, they're usually small, can be dealt with adequately before it gets out of hand. And there are many other causes of blood in the urine that we can go through in a bit more in detail when you see me in the clinic. But for now, these are the major reasons as to why some people have red blood cells found in the urine. Blood thinners are a major cause as to why you can find blood in your urine. These antiplatelet medications does a wonderful job in preventing clot formation, particularly in the heart and in the brain, which prevents heart attack and stroke respectively. So medications like aspirin, clopidogrel, heparin, and Clexane are some of the common ones that we hear in medications history of our patients. While they are very effective at preventing clots, they also sometimes cause bloods to leak up into places where they're not supposed to be, in this case urine, and therefore you can always detect some red blood cells in the urine of patients who are taking these medications. Now, the start of any workout for hematuria will start off with a history taking session whereby we look into your past personal medication history to see whether there are any reason as to why you may be having blood in your urine. This will be followed by a physical examination whereby we look for signs of previous surgery or injury that could also point out causes as well. Medication use, particularly the use of antiplatelet medications that we discussed, is also important. Now, if you have any history of cancers in the family, particularly urinary cancers, you might want to tell your urologist as well. At the end of all this history taking, we will then basically re-stratify you into three categories, which is low risk, intermediate risk, and high risk. Depending on which risk category that you are in, a risk-based evaluation will be planned for you in the next step. Regardless of what is your risk assessment, the workup for hematuria consists of three major components. The first component is usually a repeat of the urinary test, and we do this to ensure that you indeed do have blood in your urines and you do not have an ongoing urinary tract infection that could be the cause of why you have blood in your urine. This would usually be followed up by upper tract imaging, either in the form of a CT scan or an X-ray and an ultrasound depending on your risk profile. Sometimes we might also add in some colors into the CT scan to actually help us look at the upper tract better, but that would depend on the need for it as well. The last part of the workout consists usually of a cystoscopy. Now, a cystoscopy is a procedure whereby we have a direct look into the bladder itself. And unfortunately, no amount of imaging or urine test has good enough sensitivity to detect small little lesions that can be found in the urothelium of the bladder. That's why a direct look is the simplest, the most direct, and the safest way to ensure that your blood in the urine is well taken care of. This is usually a very quick 3 to 5 minute procedure. It's a day surgery. You will be given an anesthetic gel to numb the urinary tract, and it's immediately reassuring because we will be looking at the screen together with you, and we can investigate the bladder at the same time together to give you an immediate reassurance should there be nothing found. No prep is required, unlike some of the other colonoscopy that you may have experienced, like an endoscopy or a colonoscope, whereby you need to have preparations drunk the day before. For cystoscopy, it's a very simple, straightforward procedure that has no need for any preparations. It's also minimally discomfort. On the picture on your left, we show a cystoscopy done in a female anatomy, and usually a gel is all you need. On the other picture, it's basically one that of a male urethra that is being cannulated. We look into it. The whole process takes around 3 to 5 minutes, and you can be reassured immediately if there is nothing found. So what happens when you complete a hematuria workout are some of the common questions that I always get asked. Now, provided everything is normal and the results come back to be unremarkable, I always tell my patients that should you continue to have blood, small amount of blood in your urine for the next 3 to 5 years, you should not be too overly concerned. It is only when you have new symptoms like a recurrent urinary tract infection, gross hematuria, whereby you can see blood with your naked eyes in your urine, or you have persistent pain when you void. These situations, you might want to have another appointment, follow up with your urologist to ensure nothing new has since occurred. It is also important to remember that, as with all my previous videos, this video is meant to use as an adjunct for patients who have seen me. It does not replace a face-to-face consult with your own urologist. Should you have some of the symptoms that we mentioned, it is important that you arrange with your urologist or your doctor to discuss further as to what do you need to do for your own conditions.
And with that, we come to the end of today's topic on microscopic hematuria. I hope everybody gets a better understanding of the conditions and how are the investigations performed for this. It is also important to note that should you have this condition, all you need to do is to see your urologist and get it thoroughly worked out. A worked out investigation is good enough to last my patients usually 3 to 5 years, so that you don't actually have to worry about it unless there are new symptoms. Now till the next time, bye!